Hi everyone, this is Susanna, certified nurse midwife and owner of the Villagers Women's page. As a midwife, I take care of women and I also help babies out. So today I want to talk about nausea and vomiting in early pregnancy. Nausea and vomiting is quite common in early pregnancy. It affects at least 75% of women, and it's mostly related to pregnancy hormones rising. So the beta HCG, elevation of beta HCG, which is usually, it peaks usually around 6 weeks, 5 to 6 weeks of pregnancy. That's when most women tend to feel more nauseated and feel sick. But during week 3 of pregnancy, when the zygote or the blastocyst attaches to the uterine lining, it starts to produce what we call beta HCG, which is also it's also called pregnancy hormone. By week 5, week 6 is when pregnancy hormone or beta HCG tends to peak, and that's when we get most of our nausea and vomiting symptoms. How do we manage nausea and vomiting in pregnancy? Nausea and vomiting is actually a good indication that a pregnancy is heading the right direction. That means we have good levels of HCG, and that means the pregnancy is most likely a healthy one. But let's talk about how to manage nausea and vomiting in pregnancy. So I'll discuss some natural remedies you can use at home to manage your nausea and vomiting. And if those do not work, we do have options for prescriptions, and that has to come through your provider. The first thing I want to talk about to help you manage nausea and vomiting at home is using ginger. Ginger is used widely in different cultures and all around the world for multiple reasons. But ginger is also good. Ginger root is also good to prevent nausea and vomiting, or to alleviate nausea and vomiting in pregnancy. So you can do something as simple as cutting a piece of ginger root and placing it in your mouth, and just keeping it in your mouth throughout the day, like a candy, or just chewing gradually, slowly on it throughout the day as well. You can consider doing some ginger tea, using fresh ginger as well. Ideally, you want to get fresh ginger, but if you don't have fresh ginger, there are ginger tea preparations over the counter that you can purchase. You can also do some ginger drinks as well. Ginger beer is another option. Ginger, it helps. It helps to soothe your stomach. It helps to keep the nausea at bay. Another thing you could try at home is snacking throughout the day. Snacking on carbs, salty carbs works. Salty carbs, an example of a salty carb is saltine crackers with salt, of course. Keep that at your bedside. Before waking up in the morning, put a cracker in your mouth. Even before brushing your teeth, put a snack in your mouth before getting out of bed. The goal is to try to keep your belly not empty. So you don't want to keep your belly empty because that will cause you to feel sick. You don't also want to be filled. You don't want your belly to be too full. Most women do not have appetite in the first trimester anyway, so you probably won't even be able to eat excessively. But the goal is to try to not keep your stomach empty. So snacking throughout the day. Studies have shown that increasing protein intake in the first trimester helps to relieve or alleviate nausea and vomiting in pregnancy. Protein helps to keep you full longer. So that would in turn help to reduce the feeling of nausea and vomiting as well. Another thing to try with nausea and vomiting in early pregnancy is lemon water, anything spruced with lemon. You may not have the appetite or the urge to drink fluids, but this is a time that you should consider hydration, because with nausea, with vomiting, you tend to get hydrated pretty quickly. And with also your body working exponentially, growing this healthy baby inside of you, your body is working overtime. It's like you're running marathon constantly. So you want to continue to keep hydrating yourself, to give yourself the energy you need, because you don't want to get dehydrated and end up in the hospital. So hydration with some lemon water would help. Sprucing your water with lemon and mint, a hint of mint as well, would help to settle your stomach, and also help with nausea, help to alleviate nausea as well. What else? So I talked about ginger, I talked about snacking and protein. Another thing you could try, another home remedy that you can try to help alleviate your nausea in early pregnancy is acupressure. So there is a pressure point right on the wrist here. When you work your way down from your thumb area down to your tendons here, right in the middle, right in the groove here, there's a pressure point that you can activate to help you with nausea in pregnancy or nausea period, even if you're not pregnant. This works well. There are commercial bands that you could use to help you activate this pressure point. C-band, for example, is one. It's over the counter, readily available for use because, it's not realistic to keep your finger in this site throughout the entire day. So C-band or any form of acupressure wristband that activates the P6 zone here works well to prevent or to alleviate nausea in pregnancy. So we've talked about ginger, we've talked about hydration, we've talked about increasing your protein intake, we talk about snacking throughout the day, on carbs, on salty carbs, on, you want to add protein to that as well. To add to the hydration, you can also consider Gatorade, so 50-50 Gatorade mix. Gatorade has a lot of electrolytes that would help to keep you hydrated. It gives you the boost of sugar that you need for energy. You just don't want to, you want to dilute it because it's quite potent, it's quite sugary, so you don't want too much sugar. You want to have a balance in that area. Gatorade mix, Gatorade diluted works for hydration in in first trimester when you're feeling sick and vomiting. So if all fails and you would have to move to medicines, one medicine that we you generally recommend, in the OB world, is a combination of two pills, two medicines, and one is Unisum, which is also over the counter, and vitamin B6. Unisum combined with B6 works synergistically to prevent or to alleviate nausea and vomiting, and it's pretty safe. It's a class A drug, meaning it's the safest drug you can ever find for pregnancy. But yes, you want to check, of course, with any kind of medicine, you want to check with your provider. You want to check on the dosing. You want to make sure it's safe for you as the patient. Sometimes I also recommend Benadryl over the counter for my patients if other things have failed. Benadryl at nighttime helps with nausea. Benadryl has multiple uses, especially in the OB world. Again, you want to check with your provider whenever you're starting any kind of new medication or before starting any new medicine or any new regimen, check with your provider. But yes, I have suggested Benadryl in the past and it's worked for me as well. It helps with multiple things in pregnancy. It helps with nausea, it helps with vomiting, it helps with headaches, it helps with sleep. There's some women that would experience insomnia in early pregnancy as well. Benadryl works well and it's pretty safe in pregnancy too. If all else fails, there are other medicines that we can prescribe to help alleviate your nausea and vomiting in severe cases. So about 2% of cases would be under the hyperemesis gravidarum category, meaning just vomiting uncontrollably and you're dehydrated and you've depleted your electrolytes. Number one electrolyte that's usually depleted with excessive vomiting or hyperemesis is potassium. So if you're at that point, if you're within that 2% category and you just cannot tolerate any food or drink, it's probably time to go to the hospital to get checked. You want to call your provider, reach out to someone, and get some hydration going if you're not keeping any foods down at all. In severe cases of hyperemesis, we prescribe home infusion for hydration and IV anti-nausea medicines. So hopefully you won't need that, but if you do require that, it's something to keep in mind. Again, that affects about 2% of women. The first trimester is a period of survival. So do all your best to survive, meaning whatever you tolerate is what you put in your mouth. You just cannot keep your stomach empty. You cannot keep your belly empty because you will get sick. You will just intensify your nausea. You will intensify your vomiting. One final thing before I close. If you're unable to tolerate your prenatal vitamins at this time, you want to consider switching to a chewable one Keep in mind that chewable vitamins do not contain iron, which you will need in pregnancy. But at this time, again, it's a period of survival. So if you can get a chewable vitamin in, that works well as well for now. Or even consider a multivitamin, a chewable multivitamin that's better tolerated in pregnancy. You can also consider switching your routine to nighttime. So if you are taking your vitamins during the daytime, try taking it before bedtime, because then when you go to sleep, you won't think about how you feel. And at that time also is a good time. At nighttime is also a good time to take any medicines, because by then you would have had something. Hopefully you would have had food in your system. So I hope you find this video helpful. If you like what I do, please consider subscribing, and I will see you next time. Bye.